Time now for our mental health moment of the week. Approximately 1 in 3 adults do not regularly get the recommended amount of uninterrupted sleep per night. Between 50 and 70 million Americans are affected by a sleep disorder. So can the lack of quality sleep impact our mental health? And here with us to discuss is Sweetser spokesperson Justin Chenette. Justin, thank you so much. So when you don't get enough sleep, what happens to your mental health?
Absolutely. So we do see the research does indicate that there's a direct correlation between the quality of your sleep and the quality of our mental health. And there's 70% of us that actually struggle with falling asleep and staying asleep. That should not be a surprise to many people watching. But what we see is when sleep is disrupted, things like increased irritability and mood disturbances from anything from insomnia to poor sleep quality are the causes to that. We see increased difficulty with paying attention and focus and cognitive function when you don't get the amount of sleep that you need per night. And then we see an increase of risk of depression and anxiety from continued disruptive sleep patterns.
So it seems like sometimes it's a chicken or the egg conversation,
Right.
because if you have your mental health is struggling, it's tough to sleep, and then if it's tough to sleep, your mental health struggles. So what do we do?
Absolutely. So because of that direct correlation, there is that inverse impact. And I would say, the recommendation is 7+ hours of sleep, but I think we all struggle with that sometimes. But if we're able to meet those recommendations, we're able to regulate our emotions better, which is wonderful. We have increased cognitive function and physical health. But we do see that folks that may struggle with various mental health challenges also have sleep difficulties.
Yeah.
So again, I think your analogy is spot on, that we do see that correlation, and that's why it's tied together.
Okay, so what are some of the tips? What can we do?
Absolutely. So some researchers got together and said, here's some recommendations. These are probably common sense ones, but limit your caffeine intake after a certain time. It affects people differently. I drink coffee throughout the entire day, but for some, if you drink it in the afternoon, you're going to be awake at night. So be cognizant of that. It's also really important to figure out how you're winding down your day. How are you transitioning between the daily struggles at work and then at life, and then transitioning into sleep? So are you on your computer? Are you on a device right up until the time of bed? So limiting your screen time, but trying to find that moment where you're able to make that transition. Relax, unwind is so important for your mental health, but then subsequently to sleep better at night.
Yes, it's a good idea to put the screen down, I think.
Absolutely. We love it.
Yeah, all right, Justin, thank you so much. We appreciate you coming in and all the important work you do.